everyone. A warm welcome to our esteemed speaker, organizers, and attendees for joining us in today's webinar. I am Priyanshi Jain from SCRMP Madhya Pradesh Chapter, and it is my pleasure to be your host for today's insightful webinar on future drug delivery strategies for the treatment of type 2 diabetes. Before we begin, let me brief you about SCRMP Pharmacy Wing. SCRMP stands for the Society of Clinical Research and Medical Professionals. It is a registered society originating from Telangana, India, and dedicated non-governmental organization committed to advancing the field of clinical research and supporting medical professionals. Established with the goal of fostering innovation, education, and collaboration, our society serves as a hub for researchers, healthcare providers, and medical practitioners. We strive to enhance the quality of clinical research, promote ethical practices, and ensure that medical professionals are equipped with the latest knowledge and tools to improve patient care. Through workshops, seminars, and various initiatives, we aim to create a thriving community that contributes significantly to the achievement of medical science and the betterment of the global health and life science industry. Our vision is to lead an organization in advancing clinical research and pharmacy practices, improving patient care and healthcare outcomes globally, and our mission is to provide education and resources for healthcare professionals to promote ethical and innovative clinical research and pharmacy practices. The benefits of SCRMP lifetime memberships are internship opportunities with in house journals and Novo Evidenza LLP in HEOR and medical writing, event waivers where we offer free access to offline events and webinars to members, event organization opportunities, global networking, and earning through journal expansion, abroad admission support with affordable guidance on admissions including SOP, IELTS prep, and visa booking, and many more. Today, we have with us Mr. Gayor Khan sir, the General Secretary of Society of Clinical Research and Medical Professionals, a board member and co-founder of Novo Evidenza, a contract research organization. Dr. Hemant Khambete sir, HOD of Faculty of Pharmacy Medicaps University and convener of today's event, and Ms. Ritu Sapra ma'am, Assistant Professor of Faculty of Pharmacy Medicaps University and organizing secretary of this webinar. Also, Mr. Jayendra Bagil, Chairman, SCRMP Madhya Pradesh Chapter, and Mr. Nikhil Sethia, Vice President, SCRMP Madhya Pradesh Chapter. Now, I would like to request Mr. Gayor Khan sir to brief our attendees on today's webinar.
Hi everyone, my name is Gayur Khan. I am the Journal Secretary and Board Member of the Society of Clinical Research and Medical Professionals. I'm also leading Nova Evidenza as a co-founder. It's a contract research organization. I work with different clients, several clients in past like Novartis, UCB, and different pharmaceutical clients. So my expertise is in pharmacovigilance, and today we are going to today webinar is very important because sir is going to cover drug delivery topic, which is very important, I believe personally, because without drug delivery we can't we are like it's like a domain. Without drug delivery, without pharmaceutical science, it's like incomplete theory in terms of pharmaceutical field, in terms of healthcare field. So today webinar is very important, and I'm very interested, and I would like to thanks to everyone who
Thank you so
joined this
much, sir, for your thoughtful words. Now, I would like to request Dr. Hemant Khambete sir to please address the
Good
webinar.
afternoon to all of you. I firstly welcome Dr. Vivek Patel, sir, Team Manager FND Sun Pharma. Sir, we welcome you all on behalf of SCRMP
Thank
MP
you.
chapter and on behalf of Medicaps University. I welcome you and I welcome all the dear participants who participated in this webinar. The topic of webinar is very important. That is future drug delay strategies for treatment of type 2 diabetes. Now, type 2 diabetes, it is from very long time in India, but now what are future drug delivery systems or strategies which are to be covered? It will be covered by Dr. Vivek Patel, sir. And sir is having very vast knowledge as he is the FND team manager of Sun Pharma. So I think that I should express that all the participants will be benefited from this webinar. Dr. Vivek sir, I welcome you for this webinar, and also thanks to all participants who have come for this webinar. Thank you, sir.
Thank you so much, sir, for our encouraging words. Now, it is my privilege to introduce our esteemed speaker for today's webinar on future drug delivery strategies for the treatment of type 2 diabetes. We are honored to have Dr. Vivek Patel, a distinguished pharmaceutical scientist and team lead manager of formulation, research and development at Sun Pharmaceuticals Industry, Vadodara, with over 16.7 years of experience in pharmaceutical R&D. Dr. Patel specializes in non-oral formulation development of injectables like long-acting microspheres depot, liposomes, large volume parenteral, and ophthalmic-like solutions, nanosuspensions, micro and nano emulsion, micellar and non-micellar technologies. Dr. Patel holds a PhD in pharmaceutics and has completed his M.Pharm from LM College of Pharmacy and B.Pharm from Gujarat in University. He secured an All India rank 93 in GATE with 99.95 percentile, demonstrating his strong academic foundation. His work has led to multiple patents, successful regulatory fillings, and commercialization of innovative drug delivery technologies, including long acting formulations for diabetes treatment.
Thank you. Thank you very much, Priyanshi. Hope I am audible.
Yes,
Please,
sir, you're audible.
yeah. So, first of all, I would like to thank Gayur sir and Hemant sir. So, you are organizing such a wonderful webinar. And especially thanks to Ritu Sapra madam, who keep me in this loop so that I can able to deliver this. So, just I will share my screen. Someone can just let me know if you can able to see.
Yes,
Yes,
sir,
it's
it's
visible.
visible.
Good evening, everyone. So many of the participants who will join from the different location, maybe on offices from their home, or maybe from some online classes, like maybe you are in the school colleges. All I would like to give a very well good evening first off. And this is after COVID, we see that online webinars and all that are now in a trend. So this give us a good opportunity to learn from sitting at home and learn from the different. Today's topic, I have summarized that overall market segmentation. How is the big type 2 diabetes and what are the key players in that? If we see there are two types of diabetes. First is the diabetes, diabetes insipidus, and second is the diabetes mellitus, where the lack of the insulin, our pancreas, where the beta cell is there, and beta cells produce the insulin. Insulin goes to our through a bloodstream to the cells and give the message to the cells of human, where they can take a intact and convert that glucose into a glycogen by messaging from the insulin. If we see, there are three types of diabetes: type 1, type 2, and gestational diabetes. So in the type 1, this is approximately 10% of the patient who are having diabetes. It's a genetically cam, and it is a rarely happen, and it is because of there is beta cell of the pancreas cannot able to produce insulin, and because of that it will happen. And in that case of patient early stage, even in the baby stage, they can understand that they have to give insulin, and it's called insulin dependent. Health agency are giving the grants, giving the research funding to have a better research or better new upcoming modality, and if possible a good outcomes with a drug delivery as well as a basic research modules. It's increasing doubly, and it's go at 59, which is considered 60. One study where the two group of patient has taken, where one patient's group of patients have given the oral glucose, like they have given food by glucose by orally, and other group of patients have given the uh, uh, injectables by directly intravenous glucose. The first come in the market is exenatide, which come from the lizard saliva. Its molecular that amino acid chain is larger than the human GLP-1, on that half life is 3 to 5 minutes. Is a human, then it is 2 to 3 hours. For the without any microsphere and all that, by adding albumin aggregated, or by attaching the acyl or alkyl chain. Also a exenatide molecule. The ITCA 650 is a mastic osmotic pump device. It's a mastic like device can inserted in the body and remain for the 6 months or 1 year, and by the osmotic pump mechanism they can release the
Now,
exenatide.
as we have come to the end of this insightful and engaging webinar, I would like to request Ms. Ritu Sapra ma'am to please deliver a vote of thanks for today's webinar.
A warm and graceful good evening to our Honorable Speaker, Dr. Vivek Patel, Team Lead Manager, Formulation and Development, Sun Pharma, Dr. Gayur Khan Sir, General Secretary, SCRMP, Dr. Hemant Khambate Sir, HOD, Faculty of Pharmacy, Medicaps University, entire SCRMP team, and dear participants. Vivek Sir, on the behalf of my entire team, I sincerely thank you for sparing time from your busy schedule to grace this webinar. You shared your expertise and inspired us with your knowledge. We are grateful for the opportunity to learn from you. Your deep knowledge in subject was evident throughout the session, and we are blessed for your invaluable presence. Thank to respected Dean Sir, Dr. Sanjay Jain, HOD Sir, Dr. Hemant Khambate, Morzul Sir, National Chairperson, SCRMP, for being a catalyst that stimulates us to do the best.
Thank you all.
Thank you so much, ma'am, for all such thoughtful words. Before we sign off, let's stay connected and continue this dialogue beyond today's session. Keep an eye out for future events.